right, we might make a start. So welcome everyone. Thank you so much for joining us today. I'm going to be facilitating the conversation today. My name's Molly Wilson, and I'm a palliative care researcher working across St Vincent's Hospital and Peter MacCallum Cancer Centre. So on behalf of the Palliative Care Research Network, I would like to begin by acknowledging the traditional custodians of country throughout Australia and the many lands that we are meeting on today. Our traditional custodians protect and are connected to country, and we respect and honour their long traditions. Today I'm speaking on the lands of the Wurundjeri people of the Kulin Nations. We pay our respects to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. So part of my role is the coordination of a group of people called Voices for Palliative Care, which is a consumer and community engagement initiative that was established by the Palliative Care Research Network in 2022. And Voices is it's a group of dedicated community members with lived experience in palliative care who are committed to fostering meaningful collaboration in research activities, contribution to service planning and delivery, and community-driven access in palliative care. Voices members are available for individual or group consultations and partnerships with research projects, and we'll have a bit more information as to how you can get in touch with them later on. So the purpose of today's forum is to introduce you to 4 of our Voices members and to discuss their experiences as consumers in palliative care and why consumer engagement is so vital. I'll also note that this presentation is being recorded. There will be a Q&A session towards the end of the forum. So if you have any questions throughout the discussion, please type your questions in the chat box at the bottom of the screen, and we'll get to that at the end. So I'll now introduce our lovely panellists, Adrienne Copley, Christine Hofmeyer, Tristan Jallais, and Catherine Dooley. So Adrienne has worked as an accreditor for aged care, palliative care, and acute health services. She has personal experience as a carer, supporting her husband at end of life. Adrienne is passionate about raising community awareness and understanding of good palliative care, as well as more clearly identifying what the community wants and needs when faced with serious illness and end-of-life decisions. Welcome, Adrienne.
Thank you.
Christine has had experience as a carer for several family members with life-limiting illness. Along with her role in Voices, Christine is a member of the National Register of Palliative Care Consumers and Carers with Palliative Care Australia. Christine has also worked as a palliative care nurse consultant for 27 years. She has provided palliative care for patients, carers, and family in her professional role and helped inform service and policy development. Welcome, Christine.
Thank you, Molly.
Tristan has cared for both of his parents, and after his parents were diagnosed with cancer, Tristan became aware of the scope and function of palliative care. In providing care for his mother, Tristan experienced the impact of late involvement of palliative care. This was in contrast to his father, who received responsive and supportive palliative care. Bringing skills from his background in management, Tristan is passionate about advocating for quality early palliative care. Welcome, Tristan.
Thanks, Molly.
And we also have Catherine, who's coming to us today from Tatura, Regional Victoria. Catherine is a nurse and an English teacher who has cared for 4 family members who received palliative care, and 3 of them have been in the last 3 years. Catherine is interested in enabling people and families to reclaim their agency in the palliative care space. Welcome, Catherine.
Thanks, Molly.
So as we all know, there is growing international recognition that consumer and community involvement is vital to research, policymaking, and service delivery. Consumer involvement has been embedded into many processes and strategies across health research, but our understanding of consumer involvement in palliative care is still quite limited. So I might start with you, Adrienne. You've been involved as a consumer representative on various palliative care projects, working with different organisations and research teams. In your opinion, why is consumer involvement vital in shaping palliative care policies, practices, and research?
Thank you. Thank you, Molly, and welcome everybody who's joining us for this panel discussion today. I live on Kaurna country land in South Australia and acknowledge my traditional owners of these lands. So in answer to that question, I'm going to respond to each of those 3 areas. So firstly, I'll talk about policies, and I'll just touch on policies at various levels. First of all, at a government level, research findings provide evidence-based information on which governments, state, federal, territory-based, can be used to direct funding. This might be for palliative care support services, for funding specialist facilities such as a hospice or dedicated areas in hospitals, and certainly in aged care facilities, and for funding the education and training of specialist clinicians such as doctors, nurses and carers. At a facility or organisation level, the evidence-based information gained from research can and should inform the development and design of the policies and procedures. These are then used to educate and train the organisation staff in the practices that they need to deliver. These documents then should become the basis for monitoring and evaluating the practice and the subsequent health outcomes of those consumers. Secondly, the question around practices. First of all, from a high-level perspective, the researched information could and should inform guidance and resource documents such as fact sheets, best practice resources that health professionals can access and use. And there is really very good evidence of research information that has been used by specialist service and certainly now healthcare regulators to develop and make available things like toolkits and posters, specific topic guidelines that can be accessed to be used. Look, one example I like to talk about here, we have an organisation here in South Australia called LDAC, End of Life Directions for Aged Care. It's located at our Flinders University. It's a fairly large consortium of 3 unis, some peak bodies, and it provides research-based information, guidance and resources for residential aged care, home care and primary care. And that's had a lot of input. The researchers have had a lot of input from consumers. And then again, at the facility or organisation level, facilities are able then to transfer that information into their care practices, and which of course are underpinned by the guidelines and the procedures. So in this way, for me, service delivery becomes more effective and it better meets individual consumer needs. And primarily it puts patients and consumers at the heart of what is, I believe, person-centred care and service delivery. And of course, research, not forgetting that. Consumers involved in research will often have knowledge, information and ideas not known by the researcher. They can identify potential gaps and barriers in the research project or clinical trial and provide insight into how these can be overcome. They can have input into the design agenda of the project. They can provide information into tasks such as helping and developing, for example, survey questions, recruitment material, brochures and posters. And they can be very good conduit for disseminating the findings. For me, of importance, they can give insight and input into the requirements for respecting consumers' cultural safety and diversity, and can certainly offer ways of supporting these consumers when they're going to be involved in a particular project. I think such a consultative approach ensures that issues important to consumers are identified, prioritised, and in the end, this will lead to better outcomes from the research. They can, in fact, become co-researchers. So just summarising my response, I think it can be simplified to a process whereby research, consumer-based research, informs policy and guidelines that then informs best practice and evidence-based practices that leads to person-centred and effective outcomes for palliative care, patients and our consumers. So thank you.
Thank you so much, Adrienne. That was incredibly thorough and I think a great overview of the many ways that the consumer voice can positively impact all of these different areas. And I think we'll definitely come back to that point that you raised about co-partnership towards the end. So Tristan, perhaps you could draw on some of your own experiences. I know that you've supported 2 parents through vastly different palliative care experiences. How does lived experience bring a unique and valuable perspective to palliative care initiatives?
Thank you, Molly. Yeah, for me, it's actually lived experience that obviously brought me to Voices for Palliative Care. Over a 5-year period, I cared for 2 parents across 3 cancer organizations, 2 tumor streams, countless courses of treatment, 1 immunotherapy trial, 6 trips to ED, months and months spent on various wards. Sadly, 2 deaths, but lastly, 2 very different experiences with PAL care. I've seen both early, actively engaged PAL care and PAL care simply as an afterthought. That's been my experience and my story. And each of us in Voices possesses a unique lived experience. And I believe that it is these personal encounters with illness, caregiving, and end-of-life situations that enable us to offer invaluable insights to help shape and enrich your approach to care. How? Firstly, lived experience fosters empathy and understanding. Experiencing firsthand the challenges of being a caregiver helps provide a deep understanding of the physical, emotional, and social complexities involved. This understanding allows us to help researchers and practitioners connect with patients and families on a more profound level, offering not just medical support, but also genuine compassion and emotional understanding. Secondly, utilizing lived experience helps in tailoring care to individual needs. Every person's journey through illness and end of life will always be unique. For my mother, it was a very serious late diagnosis followed by an extremely challenging 10 months and a quick end of life. For my father, it was 5 years spread across 2 different cancers and a far longer end of life period. Each of them, while needing vastly different care, also shared many of the same goals. The most pressing for them were being time spent at home, trying to eat well, and effectively managing pain. By drawing from our own experiences, we can advocate for patient-centered care that respects the preferences, values, and goals of each patient. I believe this personalized approach is the gold standard, helping to ensure that palliative care is not one size fits all, but rather customized to enhance quality of life based on individual circumstances. Additionally, lived experience helps drive advocacy and innovation in palliative care. Those like ourselves who have navigated the healthcare system firsthand can often identify gaps or areas for improvement, especially with hindsight. For my mother, the introduction of palliative care felt like such an afterthought and was introduced far too late. There were no frank discussions and there was no open flow of information. I mean, on reflection, given her diagnosis, at the very least, palliative care should have been discussed during those early admissions. I mean, I, like many others in that situation, I simply didn't know enough about palliative care to advocate for it. In Mum's case, I do believe that an earlier introduction to PAL care, at least some proper discussions regarding it, could have really had a positive effect on her quality of life during those 10 months that she had from diagnosis to death. In sharing insights like these, I hope we can help advocate for policy changes, increase funding, increase communication, and new progressive care models that prioritize patient-centered approaches, holistic support for both patients and their families. In Australia, where access to quality palliative care can vary based on location resources, lived experience is particularly valuable. My Voices colleagues are based in different parts of Australia and each come with firsthand knowledge of their area, and each can highlight disparities and promote equity in access to care and also work towards building a more inclusive and comprehensive palliative care system. Voices for Palliative Care has been my first introduction to advocacy, and I truly love what we're doing and what we stand for. For me, once my grief had settled and the loss had normalized, I looked to find ways to share this experience and use it to benefit others. This group being one of them. And while it may not be for everyone, for myself, just sharing my story with whoever wants to actually listen has been a vital part of grieving, while also maintaining the stories and the legacies of both mum and dad. If in doing so, this helps someone else, not just myself, that's also a bit of a win. But I believe ultimately we all share the same goal of providing patient-centered palliative care and advocating for the wants of the patient and carer. Working with consumer groups like ours and utilizing our knowledge and lived experience just brings a patient-centered perspective to palliative care initiatives. It reminds us that behind every medical diagnosis is a person with a unique story, preferences and needs. And by embracing and integrating consumers' lived experience into your approach to care, we can all help foster a culture of empathy, empowerment, and excellence in PAL care.
Thank you so much, Tristan. And I think it's important to point out the personal benefits that being involved can have on consumers, because I think there tends to be a reticence sometimes on the part of researchers to involve consumers too early, out of confusion around the bereavement process and how long that might take for different people. So it is important to be reminded that it works both ways, and it's positive for everyone. So let's move to you, Chris. You've been one of the consumer representatives involved in actually developing Voices for Palliative Care. And I know that part of this development involved a series of scoping interviews before the group was actually formed, where I believe Stacey Pinozo and Anna Collins conducted interviews with you, your guidance, and basically looked at the things that enabled optimal consumer involvement. And I was wondering if maybe you'd be able to describe what does effective engagement with consumers look like, and what does it look like when it's not working so well as well?
Yes, thank you, Molly, and Jennifer and Peter for developing Voices and having us here today. And I'd also like to add that I live in the wonderful Fleurieu Peninsula of South Australia, which is the land of the Ngarrindjeri people, and which encompasses the lower River Murray and the Coorong. And there's such rich history from all the stories that they have provide about the development of the land, and I wish to acknowledge that. So what I'm offering today is from my own experience, but also from the experience of others that I've had the fortunate ability to be involved with and listen to. And I guess I'd also like to add right at the beginning, when we talk about challenges and benefits, that for me, the onus is on the consumer when they're involved in any project or research, as much as the researcher or the organisers, to bring their best to the group that they're involved with. And forgive me if every now and again I actually recheck and check out my notes. But for me, I sort of feel that what could be more powerful than knowing or being involved in research or a project that's actually going to influence and improve the last few days or weeks of somebody's life, as well as the significant impact that this may have on bereavement and the carers involved. So I feel that those who have a lived experience is the best way to understand what is important and how the research can improve people's experience, as well as the care and treatment they receive. And what's worked really well for me when I've been involved in anything, and that's a couple of research projects and a lot of policy development, organisational development over time, is that I want to know that my lived experience and what I bring actually matters, and that I feel that I'm valued and respected as a consumer. And when I felt part of the group and have been viewed as a partner in the research, not just as a consumer, my ability to contribute has been much more positive. So I'm not going to sit back there and look blankly through a meeting and not contribute in any way. And when I feel that when a consumer is being involved in the research from the beginning, even to the point of the development of the research question, and discussion and debate can occur, they'll feel that their lived experience really does matter. Now, that's not always possible, but even in terms of reviewing the whole draft and process and questions that are going to be asked when research is being undertaken. And it's good in any project that if support and learning is built in for the consumer to increase their confidence and skills. And in saying this, I always felt again that as a consumer, I need to continually maintain my knowledge and be informed. And I'm not always going to understand, particularly when it comes to research, all of the direct details of the study, but I need to be as informed as I can. And hence then, when the opportunity has been provided to review my involvement on a regular basis with whoever's leading the project, has been valuable. And I think as the emotional impact of often some of the topics of research can be felt by all. So it's an opportunity for the research organiser to guide the consumer, but also for everybody to actually debrief. And coming to that flexibility is important as a consumer, because they may have unpredictable circumstances, particularly if they themselves are unwell. I felt the need to remove myself from a project when my sister was dying, as I knew that I wasn't going to give the commitment that I needed and that I wouldn't have the energy to be of value. And just following on from this though, the myth about the emotional impact upon consumers or participants and the toll it takes, that's really something that I'd like to debunk, and I think it has been put on the side as time has gone on, because so often the person who is actually dying doesn't feel that their life is offering anything, that they have anything more to contribute. So no matter how small their involvement is, then that adds something to meaning for them. I think certainly when you're seeking a consumer to be involved, make sure the fit is right. If I don't feel that I've got enough information and knowledge, I don't think that I'm going to be able to contribute, then I'll say so. So it's okay to ensure by even an interview with people or an application to check that they actually are going to fit the research, because we've got our interests, but we don't know everything about everything. The outcome of the research and knowing how it's disseminated and even put into practice is important too. And that adds more even so to how much the consumer feels valued and respected. And I'd also like to know when I'm following up with the researchers or organisers that how helpful or not my involvement as a consumer actually has been. And I guess that the researcher, if they're satisfied with what we're doing, can champion in the future involving other consumers. And lastly, but not least in relation to the benefits, some form of remuneration adds to the value for the consumer, and that can again add to what they see as respectful. Just considering for what doesn't work and what does work, I mean, it's clear that they're switched around. if there's no clarity for the consumer about the role, they'll struggle and reduce what they have to offer. And if we don't feel part of the research and participating, it can restrain the progress of the research. So that's what doesn't matter. And I get what matters. And I guess even getting down to the language involved in how the consumer is referred to does make a significant difference, to feel as if maybe you're just an optional extra. And the request for last minute involvement makes us feel as if we might just be a token or a dot on the page, or an opportunity to actually get funding for the research. And abandoning the consumer once the study is complete without providing follow-up about the dissemination and outcome of the research does tend to devalue their input. We really want to know if this research has been conducted, how is it going to be put into practice? We want to actually know that it's going to make a difference. And without breaking confidences about the research, the consumer can support and encourage others to be involved. And I guess we know that working with consumers can be challenging, and a big learning curve for the consumer and the researcher, but it can make such a significant difference in my opinion. And I guess lastly, I'd leave you with a quote from Professor Mary McCarran, who is a director of the Trinity Centre in Dublin. And she says, without understanding the lived experience of those we research, we deny ourselves the opportunity for better research, greater impact, and deeper insight. So thank you very much.
Thank you so much, Chris. It's so helpful to have such specific examples of what good involvement looks like, and also what the consumer expects from their involvement. And I have a lot of questions, but I think we'll move on to Catherine, and then we'll open it up to Q&A. So, Kath, you wear multiple hats. You're a teacher, you're a nurse, you've been a carer for multiple family members, and you're also in the palliative care space. So you're well aware that community members do have barriers to accessing palliative care, like the one that Tristan raised earlier. So is there any advice that you would like to give to researchers and clinicians who might be hoping to involve consumers in their work, and sort of, I guess, educating about palliative care more broadly?
Okay, thanks, Molly. I think I've got 3 pieces of advice for researchers, clinicians out there. First one is to look for your Cs, which I'll explain in a little bit in a minute. The next one is to build on your networks and the systems that are already existing. And thirdly, to let us know what you're doing. So the first one is look for your Cs, your C for consumer. And I think that, well, we're not just trial subjects or interview subjects. As you've heard today already from, well, we all come with different life experiences. Tristan, for example, you may not know, but if you're thinking of planning a research launch, he runs a small business, has got multiple skills there, and is a wine connoisseur. So there's your go-to, that's covered. Adrienne is like our guru aged care woman who has such a depth of experience with the aged care standards and nationally. So she's our go-to there. And Christine, wealth of knowledge in advocacy and for consumers in this space, and she has exemplary skills in chairing meetings. So what I'd just like to highlight is that the people in our group, we're all united by our lived experience of palliative care, but we also come with other experiences, other skills, and from just our normal life experience. And I just sort of think the two together should be looked at, and it can be quite surprising what you'll find. So I'd just like to get you to think about your research cycle and, you know, all those little circles that bring together, and there's, you know, some can have 6 or 8, but just look for your C in each little phase of your research cycle. So it might be just formulating the question or funding or design, co-design, and then just imagine, where do my C's fit in? Where can I put my consumer into this picture and embed them throughout the research cycle? So there's a myriad of possibilities that lends itself to. Consumers can be involved in funding, in searching for grants, formulating questions, advertising, graphics, dissemination of the information. The list just goes on, and you don't have to do it all yourself, like coding, interviews, like embrace that opportunity that there are people here to help. And maybe it's sort of the little bugbears that you're not so keen to do. Maybe someone else, like I've corrected plenty of essays, and so there might be other people that might be say, oh, I'll help you with your proofreading. You know, simple things like that can build. And when you're reading somebody's work, you really sort of get to understand what they're doing, and, you know, that might be just a byproduct of doing that. So that's looking for the C's in your research cycle, where the consumer fits in. My next piece of advice is to build on consumer networks and systems that are already operating out there. The group sort of wanted me to include this little anecdote. I was lucky to receive a little grant from the Victorian Nurses Board to run community advanced care planning groups, which was, you know, death over dinner at the local Tutura bakery. So to publicise this, I went around to the Rotary, the Lions, Probus, different organisations which already existed, and talked about advanced care planning. And it sort of meets the teacher in me, because as a teacher, you're always told, don't, at parent-teacher interviews, don't have any surprises. So I think advanced care planning sometimes is the surprise we pull out, like you're going to be admitted to aged care, or you've got a diagnosis of palliative care, and advanced care planning is the surprise that happens. I think if we can prepare people earlier, it really helps with the whole process. And so anyway, but we'd have these meetings for lunch at Tap Bakery, and people was so involved that everybody had a story to share. Everybody just wanted to join in, and there were laughter and there was tears, but it was like preparing. So when they do maybe get a life-limited illness, they've already sort of been introduced. There's no surprises there, and they've already talked about advanced care planning and palliative care, because of course it lends itself to what happens at Tutura Hospital. What is the palliative care? What does palliative care look like? So in the same way that that's been introduced, I sort of think, how can we embed people being interested in palliative care research? And I had the unfortunate experience a few years ago being bitten by a redback. And then 10 days later, I had serum sickness and went into ED. And they asked me, would I be happy to see students? And this is a question that often gets asked, and most people are just more than happy to help. Like, we're in a country with a wonderful healthcare system, and I think people just are pleased to be participating in more. So anyway, so I said yes, and I think I had every medical student in Shepparton come and have a poke and a prod. But then it got me to thinking, if we're happy to have students come, why can't we, just as we get admitted, they say, oh, you know, what's your name, date of birth, next of kin, would you like to be involved in research? And maybe just something so innocent like that stamps on your history, and we've already got a lot of go-to people that are willing to participate. We know, like, a flag could come up that they're available for research. So that's my other little point. Then I was going to ask, just to flag it with any of the academics out there in the audience, that when you're doing higher degrees and you have to embed, well, your consumer within your research, but you also have to say that this is 100% my work. So to do your MPhil or your PhD. So I'm just wondering, where's the consumer's space in that? Like, does that stomp on code design, or whether there needs to be a criteria in that assessment? Have you involved your consumers within the research? So, and finally, my last thing, that's right, let us know what you're doing. I'm lucky enough to be able to pop in and out to the Palliative Care Research Network meetings. They're just an hour on a Friday. And I just feel so privileged to be able to go. And lately I've heard things like research into palliative care with the homeless, with people living with pancreatic cancer, what to do, the research with mouth care and end-of-life care. Last week it was Aaron Wong's research with switching opioids at end of life. So it's just amazing to hear what all you bright, intelligent brains that people are doing out there. It's just inspiring for us. So I'd really like that to be shared, and in sharing it, you're just creating more and more ripples and interest in your research, which would be just fantastic. So I think that's my 3 points. And if I'm the school teacher, I'll say, there's the 3. Will I reiterate them again? I'll just leave it there. But thank you, everybody.
Thank you so much, Catherine. And I think just what you were saying at the end, that is sort of one of the purposes of the Palliative Care Research Network, is to join people working in palliative care from all over Australia and broader than that, to collaborate. But the consumer voice is a really important part there. And I'm not sure that we are reaching enough consumers, and I think that's a bigger conversation perhaps, but how do we bring consumers into this conversation? But I won't take the first question because I know we've had a few come in already. So just a reminder to everyone that we are at the Q&A section. So if you have any questions, please put them in the chat box. I think the Q&A function is not working.
No.
But I just also wanted to say thank you to everyone for your wonderful discussion so far. So let's start with Heather's first question. And this was one for you, Adrienne. What was the name of the organisation out of Flinders that have developed the resources with consumers for aged care and end-of-life care?
Thank you. The name of the organisation is called LDAC. I'll get the exact thing. It's called End of Life Directions for Aged Care. So it's situated at Flinders, as I said. It's a consortium of 3 unis, 4 peak bodies, that includes Palliative Care Australia. So they produce a huge number of resources. The most recent ones just came to me yesterday. Now they're looking at nutrition, hydration in palliative care. Oh, thanks, Carolyn. Yeah, look, I sit on an aged care board, and we're using some of these resources in one of our organisations. They do focus on end of life, and for me, palliative care begins very much before those last few weeks, last few days. However, these resources are excellent. So now they've done home care and primary care as well. I hope that helps.
Thanks so much, Adrienne. So the next question was also from Heather. And I think this one might be for you, Chris. So what, if any, kind of research skills training would you suggest consumers have access to in order for them to fully participate in research? And I might add a follow-up question. do you think there's any training that researchers or clinicians need before engaging with consumers?
Yeah, I guess it's the same for both. So that if people need to know how to work within a group, how to participate in a team, and that might sound rather easy, but it's not necessarily straightforward. The consumer needs to know that, yes, they're here for their life story, but to understand that it's what they bring, and not come with a fixed agenda. So that often needs some sitting out. Education in relation to the types of research that are conducted, whether it's qualitative or quantitative, and not to necessarily understand every nuance, but to have some understanding what certain types of study are important to be able to contribute effectively. And I guess if you're thinking about what the researcher needs to know is understanding that the consumer comes with a point of view, how to actually engage with that person on a specific level, interpersonal skills basically for both the consumer and the researcher. And if you've actually never, as a consumer, done any formal sort of training in communication and interpersonal skills, well, then there's a lot to be learned in that area. So there's some of the points that I would consider and that I've probably undergone myself as well.
Thanks so much, Chris. So the next question is from Rebecca. And I think this one, maybe it'd be interesting to hear a few perspectives here, but I'll start with you, Tristan. So what are some of the gaps or opportunities needing attention and improvement that you think exist? So I know you already mentioned introducing palliative care earlier in conversation, but are there any gaps in research that you'd really like to see filled?
It's hard to say if they need to be filled within research. I mean, I think there were just some gaps in terms of, for me, the flow of information. I think each person wants something different when they have chats with consultants, doctors, and whatnot. I feel, for me, I would have loved a little bit more frank discussion about the medications, the opioids, their effects, their side effects. I think that was sometimes a little bit glossed over. And I think the other one that is really, I guess, patient and carer dependent, open discussions about death and what to expect in those very late stages. So just so they're not so much of a shock. I think addressing that earlier in the piece, and of course, PAL care is not just end of life care, but it is quite a large factor of it. And as a consumer, I think the first time around, it felt like we were very much in the dark about what to expect in those final weeks, those final days. Whereas the second time, I kind of was a seasoned pro, I guess. I could see the signs. I knew what was coming, which is for better or worse. But yeah, I think a little bit more of an open discussion about death, or another way to convey that information to the consumer, but also to the patient. I think there's comfort in knowing kind of what lies ahead and what to expect.
Thanks so much, Tristan. Did you have anything to add on that point, Kath?
Look, recently we had a patient in palliative care and she was there for a couple of weeks. And then I said to her about her death and dying, and she said to me, "Oh, I wondered when somebody was going to bring that up." Yeah. So I think that, we shouldn't worry about the hesitancy, and in one way, I don't know whether I'm sounding a bit strange here, but I see it as sacred ground, and you're embarking in an area where, to me, people just want to feel safe and secure. That, to me, is one of the biggest factors to it. And if they've got that, and I think open communication is a way that you can provide that safety and that security. Does that help?
Yeah, thanks, Kath. And in a strange way, that sort of mirrors what Chris was suggesting about consumers involved in the research process and the importance of clarity around goals of involvement and parameters of involvement. So I think across the board, receiving transparent and honest communication is really empowering.
Yeah, true. And just picking up from Tristan about the death and dying, it's amazing how many people, like at the lunches, were asking what happens when you die, what is the dying process at the end? And so there's this interest in it, and I just think the more knowledge we can give people, the more empowering it is for everyone and their carers, and to look for signs, and it just helps with the whole process. Yeah.
Thanks so much, Kath. I think we might have another question for you. You made a great point, Catherine, about issues with consumer involvement with doctoral studies. I'm doing my doctorate on palliation in the ICU, and I'm only starting on the proposal now. I want to reach out for consumer involvement, but I don't know how, and I can't have any team above me apart from my supervisors. So how can the consumer take a special advisory role if they're not my supervisor?
Is that?
So I think that was a follow-up on the point that you made, and the sort of frustrating rigidity of the academic process in the sense that it does exclude the consumer voice and doesn't really privilege it at any point. And often that's people's first introduction to research. So how can we bring that consumer voice in that academic space?
Well, I just think that maybe it's an academic question in terms of being a real academic question, where maybe there needs to be a criteria, or maybe you invite a consumer onto your advisory panel, if I've got the right sort of lingo, like for when your meetings as you're going through your PhD. But the person who asks the question is more than welcome to come and talk to us, aren't they, as a group?
Yeah.
For our voices, we'd be more than happy to get together and help you.
Thanks, Kath. I'm just catching up on this comment. So we'd be more than happy for this event to be shared. My email will be shared at the end of this conversation, so feel free to reach out to me and we can take it from there. So we've got another question. Some have already been covered, but have you got any recommendations for best ways that researchers can support consumers to facilitate contribution? So I know that, Chris, you've mentioned partnership and remuneration, but how about Adrienne? Did you have any ideas on this? So feeling empowered to contribute.
Thanks, Molly. Yes, of course, agree with what Chris has said. I believe that if you're welcoming a consumer onto your research project, and I also include clinical trials around that, because that's what I'm looking at sometimes when I'm out doing some of my work. But I think if we can, and Chris touched on it, I think if we can support them, once they come on, support them in their role, give them the confidence to be able to contribute. And I guess it goes to that point about respecting the input and valuing the input that they can give. So I agree with some remuneration, those sorts of things. But I think once you get your consumer and you sort your consumer, help them a little bit, do some training with, just advise them what you want them to do, support them. And I think one of the problems, not problems, but the people who are going to need more support than others are perhaps some from your cold or your diverse community. But just support them in their role, give them confidence.
Thanks, Adrienne. And Tristan, I know that Voices is your first experience as a consumer, but from your experience so far, how have certain things facilitated contribution, and what sort of feels good and what doesn't?
Yeah, I think honestly it's probably unique to each person, but I think just feeling like a sounding board is actually really nice. Like even if it's just a base level, like sounding things out, or if it's a deeper level kind of question of research, it feels nice to be able to share something. I mean, that's what I get from it. I came into this with zero expectations, so it's nice to feel that you're a part of something. If it's a research project, if it's a new initiative, if there's a little bit of info that one of us can actually offer that really helps to either reiterate the point or kind of change course, that's fantastic.
Thanks, Tristan. And we've just had one more question come in, which sort of echoes one that I had in my head. There's a lot of interest in co-design as a methodology in terms of working more equally with consumers. Is there room for consumer-led research, consumers actually initiating the research and running the research? I might go to you for this one, Chris.
Right. Yeah, interesting point about consumer-led, I guess. Yeah, certainly I'm a big fan of co-design when it comes down to research or particularly delivery of services. And so I'm a great believer in having a consumer. I responded to a question a while back from PCA in terms of what would I see would make a difference. And I said, having a consumer on every parliamentary body or inquiry that was looking at delivery of palliative care. And so really having for all sort of organisations involved in palliative care, actually having a palliative care a consumer on the actual board, having a specific research, a specific strategy for engaging consumers. And consumer-led research, I guess then that involves the consumer having training and experience. It can't be done just off the cuff. Even with my background, I'd still want to actually do quite a lot more training. I think that if you're looking at consumer-led research, you'd probably need a group of consumers or a body of consumers actually conducting the research rather than a single person.
Thanks, Chris. And I think one of the wonderful things that we've discovered with Voices, or perhaps it's not a new discovery, but that having multiple people with diverse lived experiences in the same place, it's sort of unlimited, the potential of ideas and bouncing off each other. And I believe in the research that Chris has done previously, a key theme that kept coming up was that one consumer is not enough. You need at least two, and I think that's where consumers feel more empowered, but also so that consumers are equally partnered with the research team. Did anyone else want to add to that question around consumer-led research before we close up?
I think there's that body of work for participatory action research, which and it's very appealing because it comes from grassroots, and yeah, it's very inclusive and yeah, so that's what I'd like to add to that consumer involvement there.
Thanks, Kath. Well, I think we've nearly come to a close. I'd just like to thank everyone so much for sharing today. And I'd also like to thank Alfie, Peter, and Jen for their support behind the scenes. But I'd like, rather than finish with me, I'd like to invite our lovely panelists to make one final closing statement. And I'll pose a sort of broad question to you all. As we look to the future of palliative care, what changes or improvements do you hope to see in terms of consumer involvement? So I'll start with you, Adrienne, if that's all right.
Yes, that's fine. Just a little bit of background, I think, for me. I'm across the country, as mentioned right at the beginning. I do assessments for hospitals for an organisation, have done so for many years. I've also worked in the private sector where we had a hospice. So, and I guess what I just want to say is that I came to Voices for various decisions, but one of the issues, I've seen good palliative care and I've seen not so good palliative care. So I think it was about reference, you know, that Tristan talked about it as well. For me, going forward in the future, one of the things that I would really love to see is better community awareness about palliative care. We talk about palliative care and we talk about the last few days, or it could be the last few days of life, which is really important because that's when you've got to manage your pain, your nutrition, your hydration, the death and dying part of that as well. So if I'm talking about the future, what I would love to see from a research, I guess, perspective is about raising community awareness about early palliative care. So about accessing the services that can providing you perhaps with some financial understanding, supporting your family and your carers. And again, from your diverse backgrounds, I guess the other thing is access is just difficult in some areas. But as I said, I think my little quote I've got here is, quality of life should be the primary goal when a person seeks palliative care services. And I think that quality of life is about not leaving it too late, as Tristan talked about it. But I would really love to see our community have better awareness around palliative care. I think it would reduce the fear of the discussion. People are even scared to put down their advanced care directives. So that's where my hope is in the future.
Thank you so much, Adrienne. And Tristan?
I think for me, just more like a real focus on the free flow of information, just increases in communication. When new initiatives come through, just send them out to groups like ours, like we're the ones that are actively wanting to kind of read these and engage with them, I think. And I think that's just one extra way to get them into the communities by having advocates like us that have a vested interest in it. I think just that real easy free flow of communication is paramount. Beyond that, I think also just focusing on the access of information to the general public. I think still, to follow on from Adrienne, I think there's just still so much the general public doesn't know. And I think just focusing on how do we get that information to as many people as humanly possible, I think could be a real focus.
Great, thank you so much, Tristan. Christine?
I think one of the big areas is certainly equity. There are big gaps, and it's a postcode lottery, the rural services. The linguistically diverse, the homeless, those marginalised groups, how we can improve access and create equity across all regions. And certainly from my own personal experience with cancer is a support and education and training or even research into people in the acute care setting. More people die in the acute care setting than they actually die anywhere else. Yep. And so I saw the inability of people who are looking after me to actually even broach on any level the impact of my diagnosis. And so I think there's a lot of fear and a lot of misunderstanding. So, but certainly equity is the big thing at regional rural services, how we can improve palliative care delivery to them. Yeah.
Thanks, Chris. I've got a couple of minutes left, so I'll leave it to you, Catherine, to close us off.
Oh, thanks. I'm just thinking, when we are doing advanced care plans, maybe just ask people, in the event that you are diagnosed with a life-limiting illness, would you like to be involved in palliative care research? You know, have that discussion a little bit earlier, so when the clinician comes in, it's already been talked about beforehand. So that's what I'd just like to add. And thank you very much. And thank you for the opportunity. And yeah, it's been great. Thanks.
Thank you all again. Just to let everyone know, this recording will be available on the PCRN website in a couple of weeks' time, but we'll leave it at that. Thanks very much.
Thank you. Bye. Thank you.
Bye. Bye. Thanks everybody for listening.
Thank you.
Bye.